Great. All right, good afternoon, everybody. It is Friday, April the 10th, 2020. I am Dr. Ballard, Co-Chair of the Montgomery County Board of Commissioners. I'm here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Brenda Weiss, Administrator of our Office of Public Health, and Dr. Al Wong, Regional EMS Director. Since our April 9th press briefing, we have 193 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 1,695. These positive individuals are from 43 municipalities, of which 2 are reporting their first cases. Pennsburg Borough has 1 case, and West Conshohocken Borough has 1 case. This takes us to 61 of our 62 municipalities that are home to individuals with COVID-19. The individuals today range in age from 10 months to 102 years. You can check our county map at montcopa.org/COVID-19 for an update on the location of how many cases are in each municipality. The age today, 3 are 0 to 9, 3 are 10 to 19. 21 individuals are between 20 and 29. 13 are between 30 and 39. 21 are between 40 and 49. 32 between 50 and 59. 35 between 60 and 69. 20 between 70 and 79. 21 between 80 and 89. 23 between 90 and 99. And 1 between 100 and 109. There are 110 females and 83 males. 13 are hospitalized, 29 are not hospitalized, and 151 we don't have information on. Unfortunately today, I am here to confirm that 13 more Montgomery County residents have lost their lives to COVID-19, which brings us to 62 deaths. One is a 94-year-old female from Upper Gwinnett Township, a 74-year-old male from Upper Gwinnett Township, an 82-year-old male from Springfield Township, an 83-year-old male from Springfield Township, a 94-year-old male from Springfield Township, a 70-year-old male from Springfield Township, an 83-year-old female from Upper Providence Township, and a 57-year-old male from Trapp Borough, an 88-year-old female from Upper Gwinnett Township. 6 of these individuals died in the hospital, 6 died at a long-term care facility, and 1 is unknown. In terms of the racial breakdown, we have 5 Asian, 2 Asian Indian, 1 Asian Korean, 6 Black or African American, 27 white, and 21 that are unknown. And I remind you that the data that we have on race is from self-report of that individual's family or from the death report. And unfortunately, on these death reports, it's not always noted what the race is. Our hospitals do continue to all have beds available. And again, I want to thank everybody for staying at home. It is tightening a little bit, but all of our hospitals still have regular and ICU beds available, which is extremely good news. The update on our long-term care facilities is a little bit different than what I've presented the last few days. In addition to tracking the 75 Pennsylvania Department of Health licensed long-term care facilities in Montgomery County, we are now adding into the mix other congregate care settings that have overnight services. So now this list of facilities that we're following is about 620 locations. The Offices of Health and Human Services are conducting a coordinated effort to have daily contact with the long-term and congregate care facilities in the county to assess the real-time occurrence of COVID-19 in these sites. Today we have 63 facilities that are reporting positive cases of COVID-19. 40 facilities have 1 to 5 cases, 9 facilities have 6 to 10, 3 facilities have 11 to 15 cases, 4 facilities have 16 to 20 cases, One facility has 21 to 25 cases. 3 facilities have 26 to 30 cases. 2 facilities have 31 to 35 cases, and 1 facility has 36 to 40. This totals 291 cases involving residents and 183 that involve staff at these facilities, 183 cases involving staff at these facilities. Outreach is ongoing to these hardest hit facilities in order to help assess their needs and provide guidance based on CDC and Pennsylvania Department of Health guidelines. And as I mentioned yesterday, the Pennsylvania Department of Health has engaged ECRI, ECRI, to help provide assistance and guidance to these facilities. I have an update on our Montgomery County Correctional Facility. Early this morning, we were notified that 2 inmates at the Montgomery County Correctional Facility have tested positive for COVID-19. The 2 inmates were quarantined on April the 7th after being seen by the on-site medical provider. These 2 inmates remain in isolation. The cellmates of these 2 individuals are currently asymptomatic and are also in quarantine. As a result of potential exposure and in an abundance of caution, 155 individuals are in quarantine at the correctional facility. All are asymptomatic. Just as a reminder, as an update, since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population at the correctional facility has gone from 1,342 to 1,060 as of today, a decrease of 282, which is a 21% decrease. Since March 12th, there have been a total of 440 discharges, and the average number of daily commits is now 5 to 6 per day, compared with 28 per day before March the 12th. Our community-based testing site is now closed at the Temple Ambler campus, and one last huge thank you to Temple University, the Temple University Police, Upper Dublin Township, the Community Ambulance Association of Ambler, the Pennsylvania National Guard, and numerous county departments who have helped us at that site. As of the end of day yesterday, we have tested 4,884 individuals. We have 78% of those results back, and we are running about 18% positive. We will relocate this drive-through site to the campus of the Montgomery County Community College in Whitpain Township. I want to thank the leadership of the college, including Board Chair Frank Custer and Interim President Dr. Vicki Bastecki Perez, along with Whitpain Supervisors Chair Michelle Minnick, numerous people in Whitpain Township and at the community college for their support as we transition this site. We hope to have the new site up and running by next Wednesday, April the 15th. The appointment process will be the same. As soon as we are ready to take appointments, we will make an announcement. And I just want to draw your attention to today's graph, which is a summary through April the 3rd of where we are with results from our community-based testing site. The graph represents the number of people that were tested each day, and the orange bar kind of shading in across the top represents the percentage of people that were positive that were tested that day. So as the results have come back, we've got the number of people tested and then the percent of people that were positive that day. So you can see that the orange bar is a little wider now than it was back in the very beginning, back on March 20th when we started. But the good news is it's not a lot wider. So we were in the early days running about 12 to 14% positive. Now we're running in the 20% plus or minus range. And this very relatively minimal increase is thanks to all of you who have undergone enormous personal sacrifice, both in your business lives and your personal lives, to stay at home. And we just want to show this as a picture of how well you are doing. It is because of the social distancing that we are seeing a modest increase, but not the astronomical spikes that other communities have seen who did not start social distancing in a robust way early in the course of disease. So we feel good about this. We are grateful to everyone who is helping us keep this number as low as possible. Our hospitals, our healthcare workers, our first responders, they are grateful too. And so are all those people in the grocery stores and the pharmacies and the supply chains behind them, the telecommunicators here in this building, all the people that I work with every day. We all thank you for staying at home because you are keeping everybody safe. I want to announce some additional good news, which is that the Southeastern Pennsylvania Surge Medical Assistance Response Team, SEPA SMART, has arrived at Suburban Community Hospital and is beginning to set up a 40-bed hospital within Suburban that will be able to take COVID-19 and non-COVID-19 patients should the hospitals in our region require surge capacity. The unit will be staffed by volunteer physicians, nurses, and other medical personnel from the SEPA SMART team under the clinical direction of Suburban Community Hospital. SEPA SMART is overseen and funded by the Southeastern Pennsylvania Regional Task Force, chaired by Montgomery County Department of Public Safety Director Thomas M. Sullivan. And we want to thank all these folks so much. We want to thank the administration and staff at Suburban Community Hospital, as well as Prime Healthcare, which owns Suburban, for being so cooperative and welcoming of this effort. We are greatly relieved to have this surge capacity now in place. As we know, and we can see by the numbers, we are heading into our surge period here in southeastern Pennsylvania. So we are hopeful that we will not need this surge hospital capacity, but it is very reassuring to know that those beds are there should we need them. And this will be a tremendous asset for our entire region. So today is Good Friday, and we know Sunday is Easter. Please, under no circumstances should you gather for worship. Your church leadership in almost every single situation is doing the right thing by live streaming from their church if they're able to do that, but they can't have people in the church. The staff that it takes just to put together the live streaming often numbers 6 or 7 people. So they just don't have room for anybody else to come in. If you're going to some kind of drive-in location, stay in your cars with the windows shut or just maybe tiny crack to hear the service. Do not get out of your cars. No, we can't have any drive-through communion, anything like that. We have to maintain social distancing. We could undo all this good work in one day on Sunday if people decide to gather to celebrate this holiday. We all know what an important holiday this is, but you must celebrate it in your home or in a socially distant location. And if we do that, that will make this end sooner. If people don't do that, this could go on for a much longer period of time. So we implore you to please, please stay home. And if you decide to go on our trails, we will be watching closely this weekend. So please maintain social distance on the trails. It is critically, critically important that you do so. And with that, I'm going to turn over to Commissioner Joe Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. First off, I'd like to wish everyone watching a very safe and healthy Easter this Sunday. Easter is certainly a glorious reminder that we too will rise again. Montgomery County will rise through this challenging time. The state of Pennsylvania will rise through this challenging time, as well as our nation. It's been a very long 5 weeks as we're working hard to combat and mitigate the spread of COVID-19 in Montgomery County. And today I'd like to share some encouraging numbers that show the effectiveness of our efforts here in Montgomery County. The Emergency Operations Center has been fully activated for 33 days since the first case of COVID-19 appeared in Montgomery County on March 7th. We've received an estimated 65,000 pieces of personal protective equipment for first responders and healthcare workers. These items include gloves, protective suits, N95 masks, surgical masks, and respirators. We have received 8,020 phone calls and 1,060 emails to our COVID-19 information lines. We've also received thousands of calls with our Office of Public Health. I'd like to give a special thank you to our administrator of the Office of Public Health, Dr. Brenda Weiss. Her team's doing an outstanding job helping getting people set up for testing and taking care of their needs, as well as our regional EMS director, Dr. Alvin Wong, who's doing a great job on the EMS side of this effort. We have driven 1.6 million views to the county's COVID-19 Information Hub website with a daily average of 56,000 visitors, and 99 countries have visited the Montgomery County Hub website. We have aired 840 hours of COVID-19 programming on the Ready Radio FM network. These press conferences, the audio is streamed on the Ready Radio network along with other important information for the public to be aware of. And we have registered 3,000 new people on our Ready Monco emergency notification system, where you can stay updated via text messages or emails on important information regarding the pandemic that we are facing. We've also recruited 1,268 members on the Make Masks for Monco Facebook page, which is an organized effort of volunteers who are using their sewing skills to make protective masks for local doctors, nursing homes, and others in need of masks. So I'd like to thank everyone who's worked very hard the last 5 weeks to help us put an end to these challenging times. I'm proud of the team effort and everyone that stepped up to the plate and goes above and beyond to put an end to this. So again, to all of you watching, have a blessed Easter on Sunday, and keep faith that we will get through this together. Thank you very much, and I'll turn it back to Commissioner Arbush.
Thank you. So just a couple last remarks about National Public Health Week. I am a very proud member of the American Public Health Association, and in the midst of this most challenging public health crisis of our lifetimes, it's important, more important than ever, to celebrate public health and all of the workers in this area. Public health tends to work a little bit unseen and behind the scenes. Strong public health systems ensure that we've got clean water and food that's safe to eat, that our seniors and our children have access to life-saving vaccinations, and that we all have the data that we need in a moment like this to help take care of our communities. It's been a pretty unbelievable situation these last several weeks. I'm in regular contact with many of my colleagues that work in public health across our region. We share information, we pick each other's brains, we kick around ideas. No idea is too crazy right now. And we are also every day talking about what's next and how we're going to move forward and how we're going to unwind this very, very complicated situation. So I just want to personally thank all of my friends and colleagues. I want to thank all the folks at Johns Hopkins Bloomberg School of Public Health, where I got my public health degree. Hopkins has been incredible throughout this entire pandemic. Their dashboard of worldwide cases has been the go-to site to understand how this pandemic is affecting everyone in the world. And I think when you look at that website and you look at those maps, it's just a really important reminder of how connected we are all on this planet. This pandemic doesn't care where you live. It doesn't care who you voted for in the last election. It doesn't care who you love or what religion you practice or what religion you don't. This is how pandemics are. They affect every single one of us. We're all in this together, and the way that we get out is to hang together as a community, doing the right things, following the best data and the best evidence that we have, even when it's a rapidly changing situation like this one. So I just want to thank everyone involved in this. Everyone who's at home listening, you're involved in this too, because you're doing the right thing by staying home and limiting your trips and washing your hands and taking all these steps that we've been advising you to take all of these weeks. Thank you to all of you. Stay home this weekend. Have a happy Easter if you practice, if you observe that holiday, and we will see you on Monday. And I'd be happy to take questions. I'm like ready to go. Any questions?
You're done.
I'm done. I'm out.
You know, I feel like you're probably going to say you don't have this information, but I'm going to ask it anyway.
Okay.
As you go through the numbers of people who have lost their lives, I'm struck by the number in Upper Gwynedd and Springfield Township. I know that there's significant, in both of those towns, significant long-term care facilities there. Do we know if these people had any affiliation to them or how those long-term care facilities are faring?
In both of those cases, a large number of the individuals were associated with a long-term care facility.
Do you have numbers from, well, you mentioned the number of residents and staff affected. Do you have fatality numbers from long-term care facilities?
I don't have that compiled. The question was, do I have the number of fatalities from long-term care facilities, and I don't have that number. Not compiled.
Gotcha. With the testing facility moving to Bluebell, is there a message to residents in Bluebell about steps that are taken to protect neighbors?
Yeah, the question is, with the facility moving to Whitney Township, in the Bluebell area, is there a message to those near neighbors? Absolutely. So I want to reassure those neighbors that the way this system works, and this worked very effectively in Upper Dublin Township, is that people who register for an appointment are given a number of instructions, including that they are not to get out of their car. The process is set up so no one ever has to get out of their car, and that they are expected to drive straight to the testing facility, and upon exiting the testing facility, drive straight home. There's no reason that any of these individuals should be in the Bluebell area. Virtually everything is closed there anyway, except for some grocery stores. And Montgomery County Community College is also closed, obviously. So we had no problems that we were aware of in Upper Dublin Township. It worked very smoothly. I will be honest that there were some neighbors that were concerned about it in the early days or when the announcement was made. And I will also tell you that many of those neighbors put up signs the day that the 1st National Guard unit left, thanking them for their service. So I think that from as far as we can tell from Upper Dublin, it was a very positive experience. We worked together very collaboratively. We intend for it to be the same in Whitby.
The 10-month-old seems very young. We've heard of a number of small children. Do you have any information on the 10-month-old, how the child could have gotten it? And then also, I don't know if you're able to follow back, especially on those early days of children that became ill, if you have any good news to share in terms of recoveries.
So the question is, do I have any more information on the 10-month-old that I announced today? And I don't. Actually, I don't have any information on that. You know, now that we've stopped doing contact tracing, which we did weeks ago, I just don't have that information like I did, you know, in those first couple of weeks. And I still don't have information on recovery. I wish I did. I know there's people out there saying, give us some good news on recovery. I wish I could. We just don't have the information. I'm not hiding anything. It's just not anything that we have the ability to track. If I had it, I would share it, but I don't have it.
You talk about churches that are streaming. I think we've all covered houses of worship in our region that say, you know what, we have a population that they don't have the internet. And
so the question is, there have been some churches and other facilities that have said they don't have internet capabilities and they can't stream their services. So we're going to open up our doors anyway. I would urge them not to do that. And if they do that, I would urge people not to go. There are many, many, many churches in Montgomery County that are streaming, and there are Catholic churches out of Philly that are streaming. I think the Basilica is streaming this Sunday. There are many ways to participate in an Easter Mass without leaving your home if you have a television set. So you don't necessarily even have to have the internet. I think these things many of them will be on TV. For the sake of your personal safety and your personal health, you just should not go. You're really taking a risk, and you're taking all of this effort that we have now practiced for 4.5 weeks of staying home at great, great personal sacrifice for every family in this community, and you could be part of the undoing of that. So please, please stay home.
Do you think the drive-through services are a safe alternative?
The question is, do I think the drive-through services are a safe alternative? I think they're like drive-in services.
Oops, sorry.
Not really drive-through. But I think they can be done safely as long as people stay in their cars. They cannot get out of their cars. Even if they have a mask on, they cannot get out of their cars. And if it's set up in such a way that they can hear the service from their cars with the window, no more than cracked, and they don't get out of their cars, I don't see a problem with it. But they have to resist the temptation of getting out of their cars, which I'm sure will be tempting. They can't do it. Social distance, always.
Are you concerned going forward that this week is going to be the peak for Philly and the surrounding counties as well. That's what the White House has been saying. Philly could be a potential hotspot in the surrounding counties. Are you
So
concerned
the
this week?
question is, do I think that this week is the peak? My guess is, and it's a guess, it's an educated guess, but my guess is that we are moving into the peak just based on what we're seeing in terms of numbers. It does seem like we are moving up. And I've been saying that for a few days. You know, I think we started to see the numbers really tick up about 3 or 4 days ago. And the hope is that we're going to keep that curve pretty flat, that, you know, I certainly expect that our percent positive of people from the testing site is going to tick up some more. This chart lags about 5-6 days, so it wouldn't be at all surprising to me as we get the rest of those more near-term results in that we're going to see that percent positive tick up. But, you know, the goal was not that we wouldn't see this increase. The goal was that we would be able to manage the increase, that our first responders units would be intact, that there would be enough hospital beds, enough intensive care unit beds, and enough ventilator beds for all the people that need them. That's always been the goal. And so far, from where I sit, I think now, especially with these 40 extra hospital beds that will be available sometime next week if we need them, if people continue to do what they've been doing and stay home, I think we're in a pretty decent position to get through this okay. But it could very quickly be undone with people not keeping socially distant or taking other unnecessary risks at this time. Okay, good, all right, okay, see you on Monday.